Hello, Adulting with ADHD fam. We're in a bit of a transition right now, closing out the episodes on hormones for now and entering a new series of episodes on trauma and ADHD. If there are other topics you'd love episodes on, please let me know by emailing me at contact@adultingwithadhd.com. And as always, to access older episodes of the show, please visit patreon.com/adultingwithadhd. Thank you for listening, thank you for your support, and happy adulting. The Adulting with ADHD podcast is not a substitute for medical advice. Please see a medical professional if you think you have ADHD or if you have questions about your current treatment. To support this podcast or to access the podcast archives, visit patreon.com/adultingwithadhd. This is the Adulting with ADHD podcast, self-empowerment for people with ADHD.
I'm happy today to have with me Catherine Maslin. She is founder of the Shift Clinic. Hello, Catherine.
Hello, Sarah. So great to be with you today.
It's great to be with you. And today we're going to be talking about PCOS and mental health. And I'll just jump right in. If you want to quickly tell the audience a little bit about your background.
Yeah, so I'm a naturopathic physician by trade, and I am also the founder of Shift Clinics. So at Shift Clinics, essentially what we do is we help people to shift their health in the right direction, and we do that primarily using natural therapies, so things like naturopathy, hypnotherapy, counseling, etc. So my real passion is helping women to heal and shift their health. And I guess the way that we look at things at Shift from our point of view is we're really interested in understanding the landscape of your entire health. What are all the different pieces that make up you? So this conversation, I think, is really important because when you think something like ADHD, you don't immediately go, well, my hormones or my menstrual cycle would be connected to that, right? But when you start connecting the dots and looking at the research, there's actually a lot of stuff to indicate that these things are connected. So I guess my real passion is helping people to understand that if you look at the whole of you rather than putting things into silo, you have a much better opportunity to heal. And that's, I think, what it's really about.
That's fantastic. A lot of our readers, I say readers, a lot of our listeners are super interested in connecting those dots. And I'm so happy we're talking about this. So jumping right in, women with PCOS, they tend to be more likely to have mental health challenges, including but not limited to ADHD. And why is that?
So there's definitely quite a lot of evidence to show there's an association between the two. And we don't know exactly why, but there's definitely some strong theories there. So one of them is if you look at it from a hormonal perspective, you have hormone receptors in your brain. Okay, there's estrogen receptors, there's progesterone receptors in the brain. So what this means is that your mental health is going to be influenced by your hormones. And this is why as women, as we go through our menstrual cycle, we can feel different in different phases. A lot of us would be familiar with the premenstrual syndrome and feeling a bit cray, feeling a bit emotional, feeling a bit teary, coming into your period or even around ovulation time when these hormones are heightened. So it makes sense then to think, okay, for people with PCOS, there can be different presentations. There's lots of subtypes of PCOS, but I guess the most classic one is the one that's high in testosterone. So in women with PCOS, they'll have elevated testosterone, potentially elevated luteinizing hormone. That then leads to weight gain, insulin resistance, things like acne, hirsutism, which is where they get a bit of extra hair growth in places that they would not like to. And if you have high testosterone, that's actually going to compete with estrogen a little bit and change brain function. So there's definitely theories that show that women who have PCOS, when they're pregnant, they have high levels of testosterone coming into that, and they're more likely to have children that have ADHD. So I think that's probably one of the big drivers. And then I was looking a little bit further, Sarah, and, there's a lot of issues with environmental toxicity. And I talk about this in my podcast a lot in episode 8 of season 2, which is all around endocrine disrupting chemicals. And if we look at the causative factors from that point of view and going, okay, in women with PCOS, what are the drivers of that? And one of them are these EDCs. And essentially endocrine disrupting chemicals disrupt the endocrine system, which then leads to these kind of issues. In women with ADHD, it's been shown in studies that there's a big association between BPA and ADHD, and BPA is found in plastics, phthalates, which are found in fragrances and ADHD, and also pesticides. and ADHD. So
Interesting.
it's really interesting. So it's like, okay, well, is it that there's an association directly with brain function, or is it indirectly through the hormones? And this is where there's definitely more research to be done. But I guess from a naturopathic point of view, for us, it doesn't really matter so much to have that exact answer. It's really understanding that landscape and going, okay, well, if we have a knowledge that toxins and chemicals are important, then we're going to work on them regardless. Yeah. And that's going to help hormones and it's going to help the brain. So I guess that's the lens that I would be looking at it from.
I love that lens, and I've had to train myself to think like that instead of trying to have all the answers to everything. Because I know in my case, like being at first when I was new to this whole concept, I had to have the hard information and the whys, but now it makes more sense to look at it, like you said, like holistically and, oh, this is important. Okay, I should keep an eye on that. I love that.
Yeah. And I think that's a really important thing to just bring to people's awareness, because what I find with my patients, especially, is that once they can take that concept and stop trying to fix it and look at the perfection and have all of the answers and go, okay, I'm on a journey, I've got information, I'm shifting in the right direction, then it takes the pressure off. And all of a sudden you're on a journey. You're not constantly striving for something that's not obtainable.
I don't know if you've ever been put on a waiting list, but therapy is hard to come by these days. If you need therapy and you need someone to talk to, consider BetterHelp. I've been using BetterHelp on and off since the pandemic, and it's honestly been really helpful when I can't reach my normal therapist. To save 10% off your first month, visit betterhelp.com/ADHD-adulting. That's BetterHelp, HELP.com/ADHD-adulting.
Yes, I love that. So let's say I think I have PCOS, which is not so fictional because I think I might. I don't know. But how big of a priority is it to have that official diagnosis? What could you
So
speak a little on that?
PCOS stands for polycystic ovarian syndrome. Okay, so when you have a syndrome, it's a collection of symptoms that makes up the diagnosis. Very different, for instance, if you got diagnosed with something like rheumatoid arthritis is rheumatoid arthritis. You need the certain factors, the certain symptoms, you fit into that box. Whereas with PCOS, there's a number of criteria and there's all these subtypes that can happen too. So not every woman will have this testosterone dominant PCOS, right? But for some women, their estrogen will be high or their sex hormone binding globulin will be high. So we need to really have a look at this collection of symptoms. So I do think it's important to get a diagnosis. And I think it's important to see somebody who will look at that bigger picture. And with PCOS, we want to have a look at all of your hormones. So we want to have a look at things like your estrogen, progesterone, luteinizing hormone, follicle stimulating hormone. And these are all the hormones that are involved in the menstrual cycle and that natural ebb and flow, but also your testosterone, your androgens, your prolactin. I think PCOS is very often misdiagnosed as well. So sometimes women will have what we call just amenorrhea, and it can be hypothalamic amenorrhea. So it's coming from a deficiency of hormones from the pituitary rather than actually heightened hormones, which are inhibiting ovulation, which is more the pattern with PCOS. So seeing someone to get that full spectrum of things are important. And then I guess the other thing I would ask you to just investigate is looking at your thyroid health, because a low thyroid function is associated with this picture as well. And really actually having a look into the blood sugar side of things, because I find a lot of women with PCOS, they actually don't have the markers that indicate insulin resistance, but then they end up getting put on metformin, and it just doesn't fit their picture. So when we're looking to correct PCOS, which is totally possible, we talk about this in episode 5, getting into these discussions where, is it PCOS? Is it coming from the pituitary? What's happening? You want to have all of the information. And if we're treating a patient at Shift, we want to look at all of the things. So we're not treating PCOS, we're treating the person. So this is where the diagnostics come in. Yes, that diagnosis of PCOS or whatever is important, but what's beneath that? What are all the subtypes? What's all the information? And then you can make the best decision to move forward.
Excellent. That's really helpful. And so during my Googling, I saw that PCOS can be complicated, and you just described all the different layers. So what's the process like when someone gets diagnosed? What can they expect if they're going down this journey?
So from the medical perspective, it's really difficult because there's not a lot that they can do for you. Okay, outside of putting you on metformin, which may or may not be effective in some way, really the treatment options are the oral contraceptive pill, which isn't a treatment. The pill doesn't fix your period, it doesn't regulate it, it just masks it. So when you're on the pill, it's hormone replacement therapy. So what's happening is you're on the pill, you take your blanks every month, and you get a withdrawal bleed. So it's not actually a period, it's you're medically managing that. Okay, which may work for some women, but it's not a cure. And if you want to have babies one day, which a lot of, I'm sure your listeners do, or they might even be in that zone, then going on contraceptives isn't really a great answer. Now, treating it from a natural perspective, what we're trying to do is helping your body to come back into those natural rhythms. And in my experience, PCOS does respond really well to herbal medicine, nutritional supplementation, and also dietary modification as well. So if we've got a situation where there's excessive weight or insulin resistance or things like that, then it does really help to go on a low carbohydrate diet, to up the protein, to eat lots of green things, to watch out for sugars, a lot of this really basic stuff that gets us into this situation. So the treatment journey can be a little bit lengthy. You know, for our patients, we say 6 to 12 months minimum is what is needed to start seeing a change in that. And sometimes it takes about 3 to 6 months to even notice changes. But the beautiful thing about PCOS is it's very trackable. We can track your hormonal levels to see if they're shifting in the right direction. We can track your menstrual cycle, your symptoms. We can do temperature charting, which helps you to actually look at, you know, am I ovulating? Am I not ovulating? And we have a free resource on our website, theshiftclinic.com/links, actually, to a cycle tracking guide where you can download that, and it's got the chart and it teaches you how to do that as well. And I think that's a really good tool for women just to keep track of that stuff. And we want to just shift things in the right direction. So you want to see if you can find somebody that can use herbal medicine to help to reduce testosterone, to help to support your thyroid, to help with your adrenal function, to help getting you sleeping better through the night, to help you to work out what to eat and give you some motivation to do that. You may need the mental health support. A lot of us are emotional eaters. We know what to eat, but we just don't do it because we're self-sabotaging or we're trying to suppress stuff or we're trying to soothe, you know, using food or, you know, alcohol or other things. So this is where you can see the conversation always comes back around to that holism, doesn't it, Sarah?
Yeah.
Okay, we're going to do this, but you're going to have to do all these things. And what I think people need to just understand is don't see it as overwhelming. It's not like you've got 100 things to fix. You've just got to chip away, you know, and every small shift leads to profound changes down the track. But the biggest thing I think is really that what we call the discovery phase of healing. How do you actually get all of that information and know that? And I think seeing a practitioner who understands this stuff and can give you that information, even if it's just a one-off to get your foundation, is going to be really powerful in this healing journey for you.
Awesome. So you mentioned your podcast, you mentioned your site. Can you tell our listeners a bit about all the resources you have out there? It sounds a wealth of information out there.
Yeah, I'm a creator, so I love creating things. And I think I'm really passionate about education and self-empowerment. So the Shift podcast, we've had about 250,000 downloads so far. And there's 2 seasons. So it's a bit of a different podcast where I actually went, the first season I did 12 states in the US and London in 3 weeks. And I went and interviewed everyone in person and I did a big tour.
Oh, that's awesome.
Yeah, and turned it into a docu-series. So I've got a sound designer producer, they cut it up and then I've narrated it. So season 1 takes you on a journey about gut health, which also is related to PCOS, by the way. We could do a separate podcast on that.
Yes.
And season 2 is all about women's health. And I think that's how we made this connection. And it's about, you know, understanding your menstrual cycle. What is the pill and how does it work? What is PCOS? What is endometriosis? How does infertility work? We've got an episode on menopause coming out next week, which is really cool.
Ooh, much needed. Yes,
definitely. So I'm really passionate about women and women's health and have been specializing in that area for quite a long time. But season 2, I think really powerful for women. I think for us, it can be confusing. A lot of the time, even our physicians don't understand what's going on for us.
So true. Yeah.
So we need to take our health back into our own hands. So I would recommend, if you're listening to this PCOS episode, then probably season 2 is going to be something that's valuable for you. And that's available, obviously, anywhere you get podcasts.
Excellent. And the name of the podcast again?
The Shift.
The Shift. The same. Awesome.
Yeah, The Shift with Catherine Maslin. Yeah.
Great. Catherine, it was wonderful to have you on the show. Thank you so much.
Oh, you're so welcome.